Today, we're diving right into a seriously thrilling intersection, the exact point where massive medical data meets the cutting edge of machine learning. We're looking at a recent, groundbreaking study tackling one of breast cancer's absolute deadliest complications, brain metastasis. So let's get into it and see exactly how researchers are using artificial intelligence to totally reshape the future of personalized oncology. Imagine the incredible challenge doctors are facing every single day. They're trying to predict a deadly, yet rare, medical event long before any physical symptoms even show up. Now, for breast cancer patients, the brain actually acts as this sort of sanctuary site. It's a place where malignant cells can literally hide behind the blood-brain barrier, totally evading standard treatments until it's tragically too late. So the big question is, how do you find a threat that's virtually invisible?
Well, to answer that, you need data, and I mean a massive amount of data. The researchers behind this study pulled together a staggering dataset of over 186,000 primary breast cancer patients. We aren't just talking about a small, localized trial here. This cohort spanned multiple continents, combining massive North American registries with a huge multi-center Asian cohort. They essentially built this giant training ground to teach an AI detective how to solve this exact medical mystery.
Section 1. The Brain Metastasis Threat. Before we look at the AI's findings, let's establish the clinical stakes.
The reality here is pretty grim. Once breast cancer actually spreads to the brain, the clinical trajectory drastically changes. Survival is often measured in just mere months. And the neurological symptoms, we're talking severe headaches, seizures, cognitive impairment, they catastrophically erode a patient's quality of life. This means proactive prediction isn't just some neat academic exercise, right? It's an absolutely urgent, life-saving necessity.
The numbers here brilliantly illustrate the core of the problem. Out of those 186,000 plus patients we talked about, only a tiny fraction, about 1.6%, or roughly 3,000 patients, actually developed brain metastases. We are dealing with the ultimate needle in a haystack scenario here. If you're relying on traditional statistical methods, predicting exactly which 1.6% will suffer this complication is incredibly hard. It basically leaves doctors without any reliable tool to guide proactive surveillance. Section 2. Big data meets medicine. Let's shift gears and look at how researchers actually approached this colossal data set to find a real, practical solution. So they used a specific machine learning technique called LASSO regression. You can think of LASSO as a completely ruthless editor. When you feed it dozens and dozens of clinical variables, literally everything from tumor size to a patient's treatment history, it applies a mathematical penalty. It forcefully shrinks the unhelpful or redundant variables all the way down to zero. It just eliminates the noise entirely, leaving us with only the true culprits, the absolute most powerful predictive signals hidden in all that data. Section 3. Finding the top predictors. Now it's time to reveal those core suspects. Interestingly enough, that ruthless lasso cut left us with just 5 key predictors. We've got tumor size, lymph node involvement, extracranial metastasis, which is when the cancer is already spread to other parts of the body, age of diagnosis, and finally surgery status. Now, what's equally fascinating here is what actually got cut. Variables like chemotherapy were totally eliminated. Why? Well, the AI basically figured out that the predictive signal of chemo was already captured by those core factors, like advanced tumor stages. It stripped away all the overlap to give us the absolute purest predictive model possible. Section 4. The winning AI model. Let's look at LASSO regression in action and see which algorithm actually performed best when put to the test. So researchers didn't just try one method. They tested 9 different machine learning models. On one side, you have your highly complex black box algorithms, things like random forests and deep neural networks. Sure, they sound impressive, but they can be incredibly prone to overfitting. Basically, they end up memorizing the training data rather than actually learning the underlying patterns. On the other side, we have our ultimate winner, the LASSO regularized logistic regression model. It's much simpler, highly accurate, and most importantly, it is completely transparent. And you know, the proof is right there in the validation data. This LASSO model achieved an incredible area under the curve, or AUC, of 0.907. To put that number into perspective for a second, an AUC of 1.0 is a flawless, perfect prediction, and 0.5 is literally just flipping a coin. Hitting over 0.9 on unseen data, that proves that simpler, well-selected features can actually outperform those highly complex algorithms when they're deployed correctly. Section 5. Inside the black box. Because getting a high score just isn't enough in medicine. Doctors actually need to trust the math. So let's talk about building that trust.
To ensure that critical clinical trust, the researchers use something called SHAP analysis. SHAP fundamentally transforms the AI from an opaque, unreadable black box into a completely transparent glass box. It doesn't just spit out a generic risk score for a patient. It actually breaks down the exact mathematical drivers behind that specific individual's score. It literally tells the doctor why the AI made the decision it did.
So here's how this plays out for a real patient. Let's walk through it step by step. Step 1, the model calculates a baseline risk, and that's influenced heavily by whether they had surgery and their age. Interestingly, younger patients actually faced higher risks here. Step 2, that base risk probability is additively bumped up depending on their specific tumor size and lymph node involvement. And step 3, if there is any extracranial metastasis present, that final risk score just spikes dramatically. It is a completely transparent step-by-step calculation.
Section 6. Real-world clinical impact. Understanding the math is fantastic, but let's see how this breakthrough is actually going to change everyday patient care. The absolute most amazing outcome of this study isn't just some published paper. It's a practical, interactive web application. Right now, today, a clinician can take those 5 key data points from a patient, pop them into a simple browser-based tool, and instantly calculate their exact risk of brain metastasis. If that risk comes back high, they can proactively order an MRI or even start considering targeted therapies long before a patient ever experiences a headache or a seizure. It is a real game changer.
As the researchers themselves concluded, this web-based tool can assist clinicians in identifying high-risk individuals, enabling personalized management and potentially improving patient outcomes. It's honestly the perfect example of bridging the gap between massive, abstract data science and real-world translatable clinical medicine.
We are truly standing at the dawn of a whole new era in personalized oncology. If we can use machine learning as this ruthless editor to find the hidden signals that predict brain metastasis, it really makes you wonder. As AI continues to unlock the vast, untapped secrets of our medical data, how many more of our body's hidden threats will we finally learn to predict and prevent? Thank you so much for joining me on this explainer, and keep asking the big questions.